Mountain Valley Treatment Center is a 60 to 90 day program. Our average on an annual basis is about 80 days. The skills that we teach at Mountain Valley Treatment Center are what's called cognitive behavioral therapy skills, so CBT. The therapists at Mountain Valley Treatment Center have been trained through the International OCD Foundation Behavior Therapy Training Institute. Most of them have been through the advanced training. So we are really good at what we do.
Mountain Valley was founded in November of 2011. From the very beginning, we stayed true to our core mission.
Mountain Valley Treatment Center is really set up to serve a very narrow profile of kid. Anxiety disorders and obsessive compulsive disorders. And of course there's some related depression and things like that. Our kids are the ones that their anxiety takes over their life. They get debilitated by it. They can't go to school, they don't have any friends. Or obsessive compulsive disorder, their rituals get in the way of them actually getting to school.
Getting back to school, getting back into that routine is very important for them. It's very important for their parents.
We are in what some call an epidemic of anxiety, especially among teenagers. A lot of our kids have a lot of social media exposure that's not necessarily been positive. Teenagers today are a lot more pressure than you and I were when we were teenagers.
And so the Mountain Valley families oftentimes come for an interview. They want to see Mountain Valley. We're not a hospital model. We've never been a hospital model. So families come and we don't look, we don't smell, we don't feel like a hospital setting.
We do the same thing that a specialized anxiety OCD treatment center would do in a hospital setting, but we do it on 25 acres of beautiful property off the Connecticut River.
We're unplugged. So the kids do not come with their iPhones. They do not come with their laptops. It's also very important for the anxious child to have some free time. They play chess, they play Risk, they play card games, they interact with one another. Our kids learn that they can fit in.
You're just going to teach some skills and you're going to get to a place where the kid has a different relationship with that anxiety and OCD. And that relationship is one that's not going to impact them negatively. They're going to have a better quality of life.
Day in the life of the Mountain Valley student resembles a school day. The day also involves what we call wellness modules. Obviously, individual therapy and group therapy, more fitness, farm to table.
The family work that we do, the rehearsal, they have, while kids are here, they'll go home and they'll practice some of the skills in their home environment. Things are gonna get bumpy, and then they'll come back and we'll process and we'll work through that.
I've had so many families over the years come to me and say, Carl, you saved my child's life. They were going down a very different path. And we want to make sure that they are able to face their hierarchy of fears and be able to go back to their school and stay there.
So if you're watching this right now, you've probably gone through a process of doing all kinds of Google searches. So Mountain Valley Treatment Center welcomes you. We would love to talk more about what we do. The process for making sure that Mountain Valley Treatment Center is a good fit for you and your family, for your son or daughter, is start with a phone call. Let's get some information. If that makes sense, then we want you to come visit.
Working with anxious kids, working with anxiety, working with OCD, although there's no cure, it's highly treatable. So our kids come and they feel the progress. They understand well that they're getting better.